back pain hopefully is not one of the issues you've run into. But let's look at the statistics. Someone has acute neck or lower back pain, meaning sudden onset. Statistically, we know that 30% of those people will feel really good in about a month. We also know that about 50% of people who have acute neck and back pain will have recurrence within a year, all right? So neck and back pain has a tendency to recur. So what happens if you're one of my patients or someone else's patient who's had that flare-up of their neck and back, and you know you can't get into the office till tomorrow, or if it's Wednesday until Friday? What do you do those couple of days? Well, here are your go-tos. And these are all things we talked about when our patients first come in, and we give them this little chart to bring home. So if you got your FYI take-home sheet, pull it out. If you don't, well, we're going to go over it. As a rule of thumb, ice it first. It may not help. Ice will make it stiff. However, I'd rather you have a stiff neck and a stiff back that doesn't hurt than one that's all loosey and goosey and inflamed and sore. So go with ice first. If you find the ice is not effective, or if it cramps it too much, you can transition to heat. But always go with ice first. Sometimes we'll have people sandwich the ice between an episode of heat. 10 minutes of heat, 10 minutes of ice, 10 minutes of heat. That way you get the relaxation of the heat, and you also get the numbing effect of the ice. A nice thing to do for a lot of my lower back patients is to put a lumbar support belt on, put an ice pack in there, and walk. Research has shown that walking is very effective for low back pain. Only do bed rest unless it's really, really bad and you can't move. Try to walk as soon as possible. Also, gentle stretches for the hips are really important. The knee to chest exercise, all right? We give this out all the time, all right? The knee to chest exercise. Where's the single? Here's the single knee to chest exercise. And then the double knee to chest exercise, also very good. We also have the piriformis stretch, a little more advanced. You may not be able to do this if you're hot, but you can definitely do the single and the double knee to chest exercises if you have an acute lower back problem, until you can get in for your appointment to get things loosened up and get the underlying problem fixed. So a little bit of ice, a little bit of stretching for the hips, really in the sacroiliac joints, to take the pressure off the back, work really well. Get some walking in, as brisk as you can, but get some walking in. Hey, go to the food store, grab the cart, hold on to that, and walk with that with an ice pack on your back. For how long? 15 minutes to 20 minutes is a good amount to get the ice on. Remember, the ice will make it stiff, but it numbs it up. Then you slowly work it out, and that'll get the pain going, and that'll get you through till you get in to see me in the office. You can also pick up some boswellia. You can also pick up some curcumin, or maybe increase your omega-3s, because you better be on your omega-3s. So those are things you can do nutraceutically, naturally, to help suppress the inflammation as well. That's what you do for that acute on chronic back pain before you have your chance to get in for your follow-up visit. I'm Dr. DeFabio. Thanks for liking and sharing.